Let's take a look at policy 3301, the drug and equipment list. I'm going to hit Control F. Down drops the search box. I type in spine, hit return. That takes us to cervical spine stabilization and splinting. There's no new equipment here, but we've renamed immobilization more accurately as stabilization. So you'll see a disposable head stabilizer. You'll see a pediatric stabilization device. Now this all relates to our other policy, 4102. This is the universal patient. I'm going to scroll down here in 4102. And here you'll see perform assessment of need for cervical spine stabilization. And down here, the order for cervical spine stabilization as clinically indicated by mechanism of injury with any of the following indicators: neurodeficit, spinal tenderness, altered mental status, intoxication, distracting injury. Notice under position patient as clinically indicated for safety, comfort, and to meet physiologic requirements. This, of course, relates to cervical spine stabilization. Continue down. We get to prepare for transport. Notice when the alert and cooperative patient requires cervical spine stabilization, consider maintaining cervical spine stabilization on the ambulance cot without a long board. This applies to the first responder, EMT, AEMT, and paramedic. Also notice, consider discontinuing cervical spinal stabilization in the absence of clinical indicators. This applies to the paramedic. Let's continue on. When we get towards the end of the universal, we have documentation, and this change has affected our documentation. Notice here, when cervical spine stabilization has been considered but not performed or has been discontinued, document reasons that cervical spine stabilization was not clinically indicated. Please continue on with our playlist.